Aorta. Do you know what our aorta is? Well, Dr. Kohli, it's good to have you this morning. Very important topic. An aorta is actually something very important in our body, and there's a disease that can happen to it. Can you explain more about that?
I'm so glad we're talking about this, Claudia, because it's Aortic Awareness Week, and I really want to emphasize that the aorta, which is this tube that carries blood out of our heart, it is the main tube. It kind of goes up, and then it turns around, takes a U-turn, and goes down to our legs, carries all the blood for our body. So it's the most important blood vessel that we have in our body, and there's a few different conditions that can happen to it. So we can have something called a dissection, which is exactly how it sounds. It's a tear in the wall of the aorta. And if you can imagine, you tear this important blood vessel, blood rushes into the wall and makes that tear sort of propagate and extend. That's a critical life-threatening condition. You can have a rupture. So if it pops, it's like popping a water balloon. That's it. I mean, that's a game over, catastrophic type of situation. And then you can have a condition called an aortic aneurysm, which is like a stretching out of the water balloon, where the aorta can just get really, really stretchy and start to dilate, which puts it at risk for either having a dissection or a tear or having a rupture or popping. So it's really important to talk about our aorta and to protect our aorta, because this kind of a condition can be really life-threatening.
Oh my gosh, it's so scary. I'm like swallowing over here because we all have an aorta and we need to protect it. Now, my next question is, who is at risk for these conditions, and is it something that could run in the family?
It is, in fact. And, 20% of the general population has a slightly higher risk of aortic diseases because they've had diseases in their family of the aorta before. So it's really important to know your family's history. Somebody dies suddenly, ask around to your parents or family members what might have happened or what was the cause of death or what have you. But high blood pressure is one of the biggest sort of reversible causes of aortic disease, because if you think about your water balloon, your blood vessel that's carrying all the blood out of your heart, if you have too much pressure in your water balloon, you're filling it too fast, there's too much stress on the walls, it can easily tear or pop. So keeping that blood pressure less than 130/80 and really controlling it super well. Smoking is another really big modifiable risk factor. And then there's genetic conditions like Marfan's that can increase your risk of aortic disease by 250-fold.
Oh my goodness.
So if you have any of those genetic conditions that can affect the aorta, it's really important to get screened. But if you're worried about your aorta, talk to your doctor, because there are things you can do like aneurysm screening that many of us can do in order to check our aorta, make sure we're not developing some of that stretchiness.
Of course.
That's putting us at risk.
That was what I was going to ask you, is how do we check for it, and how would someone know if they had an aortic issue or if they're having one?
So if they're having one, this is not subtle. And I remember a case from medical school where this trader was on, he was a hedge fund trader, and his stock was going down and he was getting stressed and anxious, and he stood up and pounded on the table, clutched his chest and collapsed. And that was a tear in his aorta that went all the way up into the blood vessels in the brain and his legs. And every minute counts. And Lucille Ball, who you may remember, was a famous actress. She died of a dissection that then turned into a ruptured aorta as well, and she used to smoke as well. So it's not subtle. Usually presents with sort of tearing chest pain, loss of consciousness, dizziness, lightheadedness, cold clamminess. But if something like that happens, you don't blow it off and say it's a panic attack. You pull the trigger to make sure it's not a false alarm, because every minute matters when it comes to aortic disease. Now, if you have an aneurysm, that could be something that's silently expanding, and that's where the screening piece comes in, because the aneurysms don't give you symptoms until they burst. They just kind of stretch. And so that's where you really need to talk to your doctor about whether you need that screening ultrasound.
If somebody goes to the doctor, wants this screening, what do you ask for?
It's called a AAA, abdominal aortic aneurysm screening. So you just say, I'm worried about an aneurysm in my aorta. They can look down the aorta here, which is the abdominal aorta, or they can look up here as well with the CT scan. Some people are born with congenital conditions that put their aorta at risk, make it thin like tissue paper. These are patients with bicuspid aortic valve, for example, 1% of the population. So I have a lot of patients in my clinic who I check regularly with CT scans or ultrasounds, because I know their aorta is like tissue paper, and that's what we're relying on to really carry the circulation around the body.
Oh my goodness, it's so interesting. Well, before I let you go, something we can all do starting today, how can lifestyle reduce our risk of aortic disease?
So first is don't smoke. And if you
Okay.
do smoke, quit. And I'm talking about tobacco smoke or marijuana smoke, because that's direct
Both. Okay.
toxic poison to the aorta itself. Second, if you have that family history, get the screening, but following a good, healthy Mediterranean diet, keeping that sodium in check, keeping that blood pressure less than 120 over 80, less than. A lot of patients tell me my blood pressure is 125 over 80. That's not normal. That's pre-hypertension. But just doing the best we can to protect that blood vessel that carries all of our blood through our body. It's so important. And then lastly, keeping that stress down, meditating a little bit every day.
Yeah.
Because any sudden changes in pressure, even if someone cuts you off on the road and you just get really angry and you let that blood pressure go up, that puts stress on your aorta.
Of course.
That's not something you want to do.
Yeah, take a deep breath, everyone. Let that stress go for sure. Dr. Kohli, thank you so much. Very interesting conversation this morning. Okay, make sure to email us your questions for Dr. Kohli. If you have any or something that's kind of been lingering around your mind, send it in. Send your message to mycoco@9news.com and put Kohli in the subject line.